Dr. Cody, can I just request you to switch off your video for a moment, please, and then Dr. Rian will get started. Thank you.
All right, all right. Good evening. I think we've got Dr. Cody Hanish and Dr. Parijat with us today. Can we unmute and start your videos, please, so we can start today's session? Hello.
Hello, good evening, Dr. Rian.
Good evening, Dr. Parijat. How are you? How are we today?
Good.
Amazing. We also do have Dr. Cody.
Hello.
Hello, Dr. Cody. How are we doing today?
Yeah, very
What's
good.
the
Thank
time
you.
in Australia? I mean,
Well, it's
I'm
10:30 at night.
time difference is like not my thing. So if you could just enlighten me, what's the time in Australia?
Yeah, so it's 10:30 at night on a Sunday. So I
Wow,
promise not to fall
that must
asleep.
be something. How is your Sundays? How was your Sundays, both of you? How?
Well, it was a very busy day today. Did lots of housework and now relaxing.
Amazing, amazing. And now you're with us for this live interaction on YouTube and also Zoom. Dr. Parijat?
Yes, my Sunday was busy too. I mean, I was in the clinic today, and I like your furnishing back, Dr. Cody. I can see that new place, so furnishing looks good. So,
Yes.
but
Right.
I'm sure the house gets settled as we go through within a couple of weeks. So it takes a lot of hard work for the house to get settled. So yeah.
Did you have patients today, Dr. Parijat? Did you go work today?
Yes, I did. Sometimes we are open on Sundays too, because see, Sundays sometimes people do like to come, patients who are working on the weekdays, they're also working hard. they get weekends off. So sometimes, yeah, we like to keep the clinics open on Sundays. So yeah.
Absolutely. I think let's just wait for a bit until we have people join in. This was actually going to be an Instagram live, but we made it YouTube, so that's fine. We can come again with Instagram someday and go live on maybe a different topic. Yeah. So let's just wait in for another minute, I think, and then we can just jump into the Q&A session with you two. I'm sure everyone's excited for this live interaction with you two.
Excited, yes, definitely.
Yes, so let's just wait for a bit, just for a minute, and then we can start.
Sure, sure.
Yes.
And glad to see Dr. Corey. I've been interacting with my team. So they have told that a good number of people have signed up for the program, our program. So up till I was seeing like around 45. So that's a good number. And we will be seeing a lot of people in Delhi and Mumbai. A lot of people all over the globe is actually coming, not just in India, but they are coming from Philippines all the way to India. Uh, and yeah, when somebody hears that, okay, we are providing the accommodation and food, so people get a little relaxed. So
It's great. That's a great incentive for people.
yeah, yeah. I mean, not many people do that, but I said, okay, let's get this started with because sometimes people are anxious about their accommodation and food, so especially in a new country. So
Yeah.
we can't wait to see you when you come to your India trip.
Yes, I'm looking forward to it. I'm looking forward to my holiday coming up in a few weeks, but also then in March as well.
Absolutely, absolutely. Well, you're going to enjoy, and you're going to get the air of India. Good, bad, you decide.
I'm sure I'll love it.
All right.
Muted. Yeah, I think it's high time we start so we can accommodate as many questions for you two, and I can shoot them towards you as much as possible. Yes. So I'm not sure if you can see YouTube. Everyone's no. Can you see the YouTube from you guys, like the chat?
I don't think so. We can see any.
So basically, I'll be going ahead and asking your questions for today. Are we keeping this chat open for our viewers as well towards the end, so then we can just enlighten, yeah,
Yeah, you
our
can
viewers.
you can put the chat open for people to ask if they can ask any questions, relative questions. I know many people might be asking about other questions as well. So whatever questions, Dr. Rian,
Let's
comes
stick
your
to the
way,
topic.
yeah, let us know.
All right. So let's begin. Good evening, everybody. We're here with Dr. Cody Hanish. He's our expert chiropractor all the way from Australia. And we've got Dr. Parijat Kumar. He's a US expert and the best in manual therapy field, physiotherapist. So let's begin with today's Q&A. Obviously, before jumping into something more serious with our questions, let's keep it a bit light for you two. So I'd like to ask you all, if you all weren't a chiropractor or a manual therapist, what is the other career y'all would have, chosen? Just on a lighter note before I could start off with, our viewers would like to know. Right.
Well,
So
okay.
any of you two.
Yeah, so before I actually went into chiropractic school, I was actually going to university with the intent to become a pharmacist. So
wow.
that's my favorite class in my undergrad at the University of Minnesota in Duluth. My favorite undergrad class was organic chemistry. And I really like chemistry. That's the nerd in me coming out. Yeah, I was going to go become a pharmacist, and I worked at a nursing service pharmacy, which was a great experience, worked with some amazing people. And then I just kind of came to the realization that isn't actually what I'm meant to do, what I'm meant to be. It's not my calling. And then I knew that I wanted to take a more holistic approach to people's health. And that's when I don't even remember who it was. They were like, "Oh, well, what about chiropractic?" And I was like, "Oh, yeah, I've seen a chiropractor before. Sure, maybe I'll try for early admission." I applied and I got in, and kind of the rest is history. But that was my initial first thought after graduating high school. That's initially what I was going to go become.
Great,
Wow,
great.
that's something. What about you, Dr. Parijat?
Well, there were two professions that I was more interested in. One was obviously surgery in medical. So I was good in my surgical subjects. And the other one would be, without any doubt, military. So I was about to join the military in India as well as in the US. I've done my paperwork, everything, but yes, then my eyes were weak, things were weak, didn't go through the physical. So yeah, there were some limitations. And meanwhile, I was doing my physical therapy trainings and all. I was again and again wanted to go to the military part. So I was very much passionate about joining the military, whether it is Indian military or the US military when I was in the US, given all the theoretical exams and everything. But yeah, there were some limitations in medical side, so couldn't go through. Uh, but yeah, those were my profession. But I'm really happy that I'm practicing manual therapy or physiotherapy in India. I can help a lot of people because when a lot of patients come to me saying, "Sir, evidence-based and ethical things are kind of sometimes hard to find." So that's why I or we as a program or organization would like to come and help aware the people about how to go through this evidence-based. And it really feels good when you help somebody and when we get those compliments or comments or positive feedback from the participants, excuse me, saying, "Sir, what technique you taught me, I applied on my patients and it worked like magic. My patient was really happy." So it really feels good when you're bringing some change in the society in a positive and a good way. So
Yeah, I mean, hey, you didn't get to join the military, but a lot of the past participants in hands-on trainings do say you've got like a military posture and stuff like that. So hey, that works. All right, so let's move on to the Q&A. So I'm going to shoot questions for you two, I think alternate. So let's start with Dr. Cody Hanish. Dr. Cody, you've got a massive following on Instagram. How is that as a professional? I mean, that must feel great, but what are the responsibilities as an influencer do you have towards your audience that's, watching your videos on social media?
It's interesting, right? I only originally started posting adjusting videos because I wanted to show people what a really good sound technique of a chiropractic adjustment looks like. That was, and that still is my purpose now on posting those videos. Sure, you get the people interaction in that, but really I wanted to really show sound technique. And no one has ever said, "Dr. Cody, you are terrible at adjusting." No one has ever said that.
No, of course not.
But it is very interesting now, given the growth on that platform and how many millions and hundreds of millions of views my videos have amassed, in that I feel like now it's my responsibility to help further the profession. So I hope that there's a lot of people out there that'll watch my videos that go, maybe I should go see a chiropractor for whatever problem they have. Or maybe they should go, I haven't thought about that before. Maybe I should just ask anyone, ask for help. And it is perfectly okay. And I want people to go out there and get the help that they need. It is not okay to live in pain. It is not okay to suffer. It is not okay to do that. So reach out to, I don't care who they are, any kind of a professional, and get some good sound advice. And that's I see my now purpose is to really showcase and highlight what we can do, but it's also just to help people in that way as well.
Yeah, I mean, I've seen your videos, and the patients' expressions are just too funny once they get the pop, and you've got those crisp pop sounds. I mean, that must be fun. Well, love that. I mean, with great power comes great responsibility, and you've mentioned about how you're trying to reach out and help the society and them get back to you if they're having any issues or any pain. I mean, nobody should be living with that, right?
Correct.
So that's amazing. Thank you.
Yeah.
Okay, let's move on to Dr. Parijat. So we're seeing Dr. Parijat.
yes, I can hear you.
Yeah.
Yes.
So the next question's for you. We're seeing more untrained or half-trained professionals actually attempting these chiropractic and manual therapy and advanced manual therapy techniques. And what dangers do you think this could pose to their patients, and how do we as professionals, respond to this?
Great. That's a great question. See, when a clinician without adequate training, whether it is manual therapy, chiropractic, osteopathy, whatever genre, the risks to the patients are significant. And let me just quickly summarize that these risks include exacerbation of their symptoms, their pain, their disc lesions. If they're having a back pain, they can have nerve injuries, they can have new injuries, they can have muscular injuries. So without knowing the foundations of anatomy, physiology, biomechanics, assessment, and believe me, you will hear assessment from my mouth 100 times today, you might, sorry for that. But without a proper training, adequate training, official training, and I will be talking a little bit about the structured training as well, because we understand that people want to learn new procedures, 2 days, workshops, etc. I will be talking a little bit about that. But without proper assessment, practitioners are just might be treating the symptoms rather than the root cause. So that's my stay. And I mean, if you can't treat the root cause of the problem, I'll quickly give you an example. It is very important to know where not to do these techniques before learning where to do these techniques. So in all my areas, I teach that like it is just like a metabolic coach or a nutritionist. Like if you go to a nutritionist, and I sometimes I ask these questions to my people, that what does a nutritionist do? Number one thing, if you want to do a weight loss or whatever, they tell you what not to eat. Forget about eating. They tell you what not to eat. Stop that, stop this, stop what, stop carbs, starchy carbs, whatever. So me, same way, we need to learn where not to do it. A proper, adequate training is required where you stick to the fundamentals, and we'll be talking about that, and apply these interventions and know the red flags and the contraindications. Applying these techniques without knowing contraindications and red flags to the patient is actually a great risk for the patient. As a professional, we have a responsibility to lead by an example. So I truly emphasize the importance of a proper, comprehensive manual therapy or chiropractic or whatever you want to learn, but a proper, comprehensive structured training. So, yeah.
Absolutely. It's like giving a scalpel to the surgeon and who's only watched Grey's Anatomy without having proper experience. So yeah, absolutely. Dr. Cody, do you have anything to say on this that I've asked Dr. Parijat?
I mean, all of that is absolutely imperative. And if you want to be a better, safer practitioner, the best way to do that is with more education, to really, really arm yourself with that information, so then you can help people. And sometimes knowing when not to do something is way more important than when to do something. And, as practitioners, as doctors, when I graduated, I took the Hippocratic Oath to say, first, do no harm. And that is evident still today. And that's what I think about every day is primum non nocere. So that saying right there is so important for people.
So if you can't fix it, don't ruin it, right? I mean, 100%. That's so important. Okay, so the next question is for you, Dr. Cody. Do you think the rise of techniques without context is actually hurting the public image of chiropractors or manual therapists? Because we've seen a rise against this as well. So why do you think this happens, and what's the cost that we have to pay?
It is a balancing act, and ultimately, would I have as much cut through, or would I have as many followers on my social media platform if I was showing everything that I possibly did during that visit? The answer is probably no, right? People's attention spans are very short. So I want to grab their attention quickly. But the caveat of that is that ultimately, I'm doing a thorough exam on that patient before I do anything. Now, most people just see, oh, you just keep doing the same adjustments or something like that. It's like, yes, but I also I checked their range of motion. Well, first we had a chat about what's going on. Then I checked their range of motion. Then I did deep tendon reflexes. Then I checked dermatome sensitivity. Then I did muscle tests. Then I also did orthopedic tests. And then we asked more questions. And then I did a proper functional analysis. So I did all of those things first because you want to be super thorough so then you can be super precise, which will get better results. But it is a fine line because ultimately I could sit there on, let's just say, Instagram, and I could show every single orthopedic test that I do on the patient. But frankly, people after about 2 seconds would already be flipping, and then that information isn't getting out there. It's not being spread properly. And sure, if 5 people watch it, great. I'm cool with that. However, I think if we're going to get the best cut through and the most eyes on it, we need to be a little bit more selective with what we show and also, though, how we present it.
Exactly. I mean, attention span is just literally the first 3 seconds. So if you've not got that, you've lost the audience. So I totally understand. But it's so much, I mean, obviously treatment techniques important, but what you just mentioned, all of the effort that goes back before all the treatment, the clinical reasoning that you've put into, and all the assessment is so important. And that's, I think, something a lot of the clinicians here, I mean, miss just to get through, right? So yeah, I mean, great. At least we've got this out there for people having questions regarding this. So thank you.
Yeah, and there are, I mean, listen, there are like YouTube is actually a great platform to show that longer content. And I've put a couple videos out there, but boy, it is a lot of editing to get one long-term video on YouTube. It is a lot. And I frankly just don't have the time to do it. So, but I do show some of it. There is a little bit more involved, but this is where you as a practitioner really should be getting all of this background, and you should be explaining to the patient, because if they come to you and say, hey, Cody, just crack me like you do in your videos, and I'll be like, whoa. Okay. And then I let them know, I was like, well, actually, I have to do all this first. And that's important because I want to make sure that what I'm doing is going to be, first of all, safe, but second of all, effective. And how am I supposed to know that if I haven't even done a full exam on you?
Yeah, totally. Yeah, great. Thank you for that insight. All right, the next question is for you, Dr. Parijat. So here in India, many clinicians are out there just chasing new techniques, like they're collecting Pokemon cards, right? So without having any investigation or proper assessment before it. And as Dr. Cody's already mentioned about how he's, he does this before. So why do you think this happens, and what's the cost again?
See, the problem is not just in India, it is globally over there. And then this is in continuation with what Dr. Corey has already spoken. So I will take this a little bit forward, and it is based on normal human psychology. The need or the appeal of using technique actually comes from the desire of giving quick results to the patient.
Right.
Professional recognition, or differentiating yourself in a competitive field. We understand there is a competitive field these days, and people want to differentiate themselves, want to give quick results to the patient, magical results. But understand that these techniques are tangible and it can be marketed easily. But assessment requires patience, critical thinking, and humility.
Exactly.
It is easy to attend a workshop and learn a procedure, but it becomes difficult to invest in proper critical thinking, proper communication, and diagnostic reasoning. So without a proper and a strong assessment, as Dr. Cody was mentioning, that you only see the best part. I mean, a movie might have been made of 6 hours, and then the editor edits it for like 2 hours or 1.5 hours, and you get the cream part. So similarly with the healthcare professionals as well on the social media, that we are not just showing you the pop parts. There has been a good amount of assessment and clinical reasoning done behind those videos. And that's why we bring you the creamy part. But the problem with today's world is, yes, they want to bring quick results, professional recognition, and they are lacking that background hard work and just wants to provide quick results, which cannot happen sometimes. So ultimately, a strong assessment process is recommended.
Exactly. I mean, we also do get even on our social media, and a lot of people just asking, "Hey, this is the condition I've got. Oh, my patient's got cervical radiculopathy. What treatment should I do?" Or this is the condition, or I've got plantar fasciopathy. What should I do now? So what is your replies to these questions that we get a lot of them on Instagram? You know that.
Well, if you allow me to answer that, I'm sorry, Dr. Cody, if you say this. I always say, and see, the topic of this lecture, if I'm not mistaken, Dr. Rian, is beyond the cracks and pops, bringing the changes in a long game of evidence-based learning. Now, long game of learning, how can you bring that to your patient? I mean, I tell all of the people over there, now I have quite a bit of experience practicing around the world, not just in India, but I practice in other countries as well. When you are practicing on your patient, please try not to, this is my personal advice, you might disagree or agree with me, do not treat a patient condition specific. Provide your management based upon the patient-centered approach. I quickly give you an example. You have a patient with shoulder, bicipital tendinopathy, supraspinatus tendinopathy, or rotator cuff injury. Condition is the same, but both the two patients can have different scenarios of your assessment. They can have different cervical assessment, thoracic assessment, rib assessment, scapulohumeral assessment, elbow assessment, but the condition is the same. They both have bicipital tendinopathy. So instead of being a condition-specific approach, I would highly appreciate people to go with a patient-centered approach. And that's why your patient will start loving you, because every patient is different. So yeah.
Exactly. Yeah, amazing. That was an amazing insight. Dr. Kodish, you have anything? Would you like to shed some light on that?
No, that's exactly what it is. The clinic and everything that I stand for is you you look at the whole patient, that holistic, that big approach. You take it back, because then they might be, let's just say with that shoulder case, it's like, well, let's try to get to the why. Why is this happening?
Yeah.
Why is this injury reoccurring? Why are you not responding like I expect that you should to the treatment that I've been administering? So and that's it does come down to a patient-centered approach. Not everyone is going to fit this perfect little cookie cutter model, and we shouldn't. People aren't that way.
I mean, loads of videos on Instagram and social media, but well, a lot of people that follow say, "Hey, this is the condition, and this is what you need to do, and this will work." Some amazing, treatment techniques for this condition. So what you're saying, and both of you saying, is they should actually go beyond just following the techniques blindly and actually do the clinical reasoning and assessment. And every patient is different, right? So even if it's the same condition, assessing the main, the regional independence behind that becomes very, very important. Yeah. Okay, amazing. So this question is for both of you. What can our generation of professionals do differently to set higher standards so that we do not leave the door open for unskilled or unsafe practices? I mean, obviously, we've mentioned the assessment part, but anything else you'd like to add on?
Okay, so I'll run with this one right away. PK and I are actually doing that right now, right? We are offering education. We are sharing our knowledge with others. And it's interesting, right? If you would have asked me this same question maybe 10 years ago, my answer would have been very, very, very different, because young, full of myself, egocentric, all I cared about was just having a busy, successful practice. And I just wanted, and I didn't really care about much else beyond that. And it is still today successful. However, now I'm at the stage in my life and career where it is just as important to give back, to not let kind of these younger practitioners come through. We're not going to try to reinvent the wheel. What we're trying to do is make it way easier for them to have a better understanding, but they also do have to put in the hard yards of educating themselves and being an active participant in that process. But I mean, ultimately, I really, and this is what gives me joy, is helping other chiropractors or manual therapists or whoever's willing to listen and learn. I will share all of my brain with you. And that's why we're running this fellowship and diploma program. And you're not going to get this anywhere else. This is, you are literally taking, I'm putting my brain on a platter for absolutely everyone. And this is why this program that we are doing is so important. And if you want to be a better practitioner, if you want to be a better chiropractor, if you want to be a better massage therapist, if you want to be a better person, this is really the best thing to do. And I get joy from that. I can't wait to educate, everyone further, but then also so that I can hear the success stories to say, oh my gosh, I just came across and I followed your patient-centered care. And we really helped improve this patient. And oh my God, because you're going to feel fulfilled because of that. And like I said, 10 years ago, I would have probably been like, no, it's all mine. I'm going to keep it to myself. But it's so important to share that. And that is how we keep raising the bar for the next generation and the next one and the next one and the next one. And I hope that there's many, many, many more generations. And I hope, one day, if I can look back on it from 100, 200, 300 years from now, I can look and go, wow, they are absolutely killing it. They're doing such a great job. And I hope that my expectations are thoroughly exceeded.
Amazing. I mean, I love what you guys are doing. It's, having this whole evidence-based program where you're not just teaching techniques, but it's right from scratch, from anatomy to biomechanics to segmental mobility, assessment, regional independence. There's so much under the same roof, and that's why it's not just a 1-2 day program. I mean, a lot of people do ask, like, hey, why is it a 1-year program? Or why so much time? I've attended 2 days chiropractic workshops, and where I've learned techniques. And yes, we do have. I'm like, wow, you become a chiropractor in 2 days, and that happens a lot, actually. I don't know how it is in Australia, but in India, we do have 2 days chiropractic workshops. People actually marketing that, but obviously not covering. And when we find out there's no assessment taught, why is this done? It's just the whole topic today was about that. It's not just about the cracks and pops, right? It's about knowing why you're doing this. And, actually, there was once where I went in for trainings, and one of my participants actually told me that, there was one of his clients that came to them, and, he went somewhere else, and they had a relative that got a neck popped, like a child's neck popped post a fall. And it actually led to his demise. So yes, and I don't want to name the professional that he went to, but yeah, that was done twice. The second time that he went there, this is absolutely absurd. And when I heard that, I was like, oh my God, this actually happens. And I think that is why it's so important, for people to actually be doing and upgrading this program and doing this program. And it's very few people in India actually are doing this. You guys are doing amazing job. Dr. Parijat, do you have anything to say on this? I mean, obviously you speak a lot about evidence-based approach and how you need to have this holistic approach with your patients. Have you heard these instances? I'm sure you have.
No, first of all, I really like what Dr. Corey mentioned about bringing it to the society, what we have gained. The problem in today's world is even the new graduates are bringing to the society. So, but it's okay. It's everybody wants to share their knowledge and all everything. It's cool and it's fun. I just want to say, guys, we are in a healthcare profession. You need to start building up by understanding the patient deeply, not just their symptoms, but about their anatomy, because everybody's anatomy is different. And everybody's physiology is different. Everybody's biomechanics are different. Everybody's pathophysiology is different. As I said, low back pain, same condition. Radiculopathy, sciatica, same conditions. But everybody's anatomies are different. Movement systems are different. Psychosocial factors are different. So understand the patient, not just their symptoms, but in detail. So, I mean, I teach in the basic and advanced foundation, which is going to happen just 2 weeks after that. Great stalwarts has said, listen to the patient. He's telling you the diagnosis. Listen to the patient. He's telling you the diagnosis. So emphasize on integrating a patient-specific approach or the patient-specific data with the current available evidence. Therapists need to start learning a little bit of a peer review discussions. You're welcome to start these discussions with Isomt, with yourself, with your colleagues. Again, we have been discussing with our seniors and superiors. We try to look for the knowledge here and there. So be hungry for that knowledge. It's not just that you have completed your graduation or your master's or your bachelor's and you are all set. No, sir. No, ma'am. This is an ongoing process. A doctor, a teacher, or a professional should be learning lifelong. Invest in themselves lifelong to help yourself in bringing a good change in the society, like Dr. Cody mentioned.
Yeah, absolutely. I mean, we still do get, participants, and the team tells us that, when we're explaining the program to them, they go like, hey, I've done this and I've already been practicing and I know everything, and it's just, there's no room for growth. I mean, I think that there's some mentality where, I've done this thing and I've done this course and my growth stops there, or I'm at a certain position, so I don't need to learn more. I've seen enough patients and experience counts. So I think that, again, as Dr. Cody also mentioned about the egocentric attitude that some people have, it's just, I don't think, what do you think? Like, that should not be something as a professional in healthcare should, or a quality, that's something that could, actually harm or do more harm to the society than good. So what are your views, and how should they take on or approach these guys?
It's a challenge.
Anybody?
Yeah. And is there one answer to fix that whole huge problem? No, certainly not. But it's leading by example. And PK had mentioned this before, is, we need to set the standard then. And
Exactly.
then I hope that everyone follows. But yeah, this is a multifaceted kind of problem. And yeah, I suppose I shouldn't have said 10 years ago that all I cared about was myself, because I didn't. I mean, that's why I'm a chiropractor, right? But there is this attitude of, I set out every day to learn something new every day. And I think that that's really important. And sometimes, sure, I have a Bachelor of Science in Human Biology. I hold a Doctor of Chiropractic. I've got advanced degrees, even postgraduates. So listen, if you can learn what I did in 2 days, wow. Why did I waste 8 years of my life learning it to the very advanced degrees? And I think it's important because it allows me to be a better practitioner. It allows me to be a better person. And I think ultimately we need to set the standard where we think it should be. And anyone, sure, every 20-year-old, 25-year-old, well, I graduated when I was 25. Any 25-year-old feels like they probably do know everything. I mean, luckily, I don't have any kids, so I'm never going to have to experience that. But I'm pretty sure that every teenager thinks that they know everything as well. But then hindsight's a lovely thing. You look back on life and the lessons that you've learned and the experience that you've gained, and then you're like, I learned some very valuable lessons. And when you look back on things, that's when you can say, you know what, I actually didn't know everything. I didn't know how difficult it was. I didn't know what was going on. And I think that that's really important. And everyone goes through that process. But I think it's imperative that us as custodians of our professions, I think it is very important that we set a great example for those younger people that are coming up through the ranks.
Amazing. I think that's what you guys are doing as well. And yeah, Dr. Parijat, do you have anything to say?
As they say, as they say, the more you learn and study, the more you come to know that you don't know things. So it's something like this. And see, with due respect, I understand what Dr. Ian was saying, that yes, there are people who have done courses, manual therapy programs. Again, it is their psychosocial factors. With due respect to whoever they have done, it might be the money part, it might be the time part, it might be the family part. So we respect all that, but it's always good to learn something more. And in order to do that, we sometimes like to shoot some examples of that, of regional interdependence that we teach. Like, say, for example, I'll give you a quick example that, do you know that you can actually can help with your, now listen to this regional interdependence concept. I have evidence to support this. Do you know that you can help your hamstring flexibility just by working on the thoracic spine? Did you know that you can increase the knee extension angle in a slump test by just manipulating the cervicothoracic spine? Did you know that I have zillions of did you knows? Believe me, did you know that just by manipulating third and the fourth rib, you can help your patients with tennis elbow? Did you know that by working on the wrist, you can help the patient with tennis elbow? So zillions of factors. Did you know by working on the pelvis and the sacrum, I can treat my patients with knee pain, heel pain, or even knee instability, pelvic floor? We have a lot of speakers who do pelvic floor on our platform as well, I guess. So understand what you are doing. And when you say, and Dr. Cody also mentioned, I think the root cause, and this might sound a little weird, is actually the neuroendocrinal problem. What I mean by that is the hunger. The hunger of growing is not the same for everybody. I want to grow financially, professionally, and personally every day, every week, every year. I'm filing my taxes today in India. Next year, I want to tell my chartered accountant, you want to increase my income and file a separate tax. You understand that? So every year, every month, there should be a hunger and a passion to learn more and more. I keep on learning. Believe me, I keep on learning. It's not like I know everything. I keep on learning, whether it is manual therapy or different researches leading me to experience more manual therapy assessment and treatment to help my population a little bit better and to help my patient. I see a lot of patients in my clinic as well. So that hunger should be within. And the good part at Isomt that we see is that we will have a lot of discussion like that. So we do not forget you after you do your program. So you're welcome to shoot your queries, your case discussion. I still get case discussions from my batch 1 people. It has finished in 5 years back. They still send me the case discussion. Sometimes they send me the investigatory reports. So I try to help them with that. We do not forget you. So that's the best part of, I think, Isomt, that we treat everybody as a family and we include everybody to learn in a personal way. So, yeah.
Yeah. And I also know that there's a lot of perks that Isomt offers. So even though we've got people passed out from cohort batches in the past, it's still a learning process. I think that's something you are putting forward. The learning doesn't stop there. Even though they've done the certification, you're advancing with your with the research and the materials and new lectures and updating everything. So I think that's something everyone should know who's also wanting to do this program with you guys. And learning just doesn't stop there, and that Isomt is with you all throughout the journey of your growth and learning, professionally and personally, right? Okay, Dr. Cody, this is for you. I'm sure patients come to you asking for the quick fixes, like, hey, I've seen this video. Can you just pop me up and my neck and my low back, and just expecting quick results? How do you deal with such patients and tell them that, hey, it's not just a quick fix? There's actually long-term work, again, depending on the case to case that you find in your clinic? How do you deal with such patients?
Yeah, so it starts right away from the first visit when they come to the clinic. What I do is, I mean, if they expect it, I mean, they're going to get a rude shock when they walk in the door, and then I'm like, okay, come down, have a seat, and then I begin the consultation process, and then I do a full thorough exam, and then after I do that, they I tell them my clinical thought process. I let them know exactly what I think is going on, my interpretation of the entire examination that we did, and the questions and the answers that we've talked about during the consultation. And I spell it out to them. I'm open and honest. Now, I don't have also a cookie cutter model. I don't say to people, hey, you need to come and see me 3 times a week for the next 12 weeks, and then twice a week for the next however, some arbitrary number and whatever. But what I do is I say, okay, from my experience or from what I know about the condition, these are some expectations. Now, do I want to help everyone right away? Absolutely. I would love that. I would love to be able to do that. Unfortunately, there are limitations with the healing process, and certain conditions also take time or whatever it is. If someone comes in with, let's just say, an L4, L5 disc herniation, there is no way that one treatment is going to fix that. It just is not going to happen. And I am very open and honest with my patients about that process and what the expectations are. I give them a program of care that I think is going to work for them, but I do let them know, hey, I'm going to kind of tweak and change it as we progress with your care, and I get a better understanding of how your body is reacting. And I think that it's really important that you are honest with your patients. And that's where, I've been a chiropractor now for over 16 years. That's where that knowledge and experience comes into play, is because, you know what, I probably have seen this before. And if I haven't, I'm also going to be honest and be like, wow, never seen this one before. This is a new one for me. And sometimes I'll say, hey, I need to do a little bit of homework myself. I need to get a better understanding of what's going on and potentially what I can help with, or who I can refer you to that's probably seen this a million other times. So I've done that before. I had a case, actually, I've had 2 cases now with this exact same condition. One was about 10 years ago, and the other one was only about a year ago. Patient came in with headaches, really severe, and they happened almost every night. And it was in the middle of the night. They would wake up and it would be excruciating, and it would last for a long time. And this was happening on a regular basis. And they said to me, they've seen every other person for this and nothing has helped. They were put on medications. They were told to try all sorts of different things, and they just weren't getting results. So they came to me and I said, the first patient that had this, I was like, this is weird. I have never heard of this before. So literally, I went and did my own research. Then I came up with a differential diagnosis of hypnic headaches, very rare type of headache. And I said, listen, this is going to sound counterintuitive, but I want you to have some caffeine before you go to bed. And he looked at me, he's like, wait, what? Why? And I was like, it's the easiest thing to try to help with your headaches. If it works, amazing. If it doesn't, we're going to try some other things, but let's just give it a go. Let's see. So he had a shot of espresso before he went to bed. And then I get a text message the next morning saying, okay, maybe it was a fluke, but I didn't get a headache last night. And I was like, oh yes, we're on the right path. So I said, let me know how you go this evening. So the next day rolls around. He goes, wow, there might be something to this. Mm-hmm. So then, because caffeine, it alters blood flow, and it had to be something like that. So that's what it's good. He, though, then on the third night, he decided not to have the shot of espresso. Okay. But then guess what happened at 3 a.m.? He had a headache. So I had, though, if I would have had a bigger ego, I would have just been like, oh, I know this, just do this, even though I would have had no idea, right? And it was important, though, that I said, hey, let me do my research. Let me try to help. Let me try to figure this out for you. And then we came up with the solution and went down that road. But it was never going to be, that was an odd case, right? And I've only ever had one case since then. I've only ever had 2 hypnic headache diagnoses ever in my entire career. And they're weird, they're rare, it doesn't happen, right? But it is really, really important to set expectations right from day dot. It is so, so important, because then your patients also develop respect for you and your advice. And that is also really important. But people are really good at picking out baloney. So you need to be honest with them.
Yeah.
And respect goes both ways. And I think
Exactly.
that that's really important. PK, what do you think? I know you're like, oh, I'm gonna come on.
No, that was a great insight. I'm sure Dr. Parijat has some instances that he would like to share as well, shed some light on this. Yeah, Dr. Parijat.
So, I mean, yeah, there are a lot of examples like that I can shoot you. But see, sometimes when people ask me that how sometimes you're shifting or teaching the students from a generalized treatment, like you asked, that sometimes patients do come to you for a quick fix and they say, hey, doc, can you pop me up? A lot of gym people, gym goers, yoga trainers, and Pilates instructors I get. Uh, Big hulks they are, they have big delts and all, but their shoulders are still weak. Their shoulders are still stiff. They have big erector spines, hypertrophied, but still their back is hurting. Why? The stiffness. Now I educate in my sessions and I tell the patients that your stiffness is not always coming from your muscles. Yes, there are many reasons for stiffness, but one of the major overlooked misdiagnosed reason for stiffness that people forget is instability, pathological instability. We do not know how to assess instability. Yes, you heard me right. Your patient can be a big hulk with big delts on the shoulder, but he can still have rotator cuff problems. He can still have a instability issue on the shoulder, though he's a big hulk. Same with the back. He can have an instability, but you don't know what is the evidence-based way to check instability part because we have not been taught like that. Example for the pelvis and the sacroiliac. There's an amalgamation of a lot of assessment and treatment techniques that we do in our clinic. And I talk to myself whenever I'm doing a technique that why am I doing this technique at this time?
Yeah.
Please start asking questions why, as Dr. Cody also mentioned a long time back, that why are you doing this technique? And just recently I shot a video like, let's not just be a soft tissue specialist. Yes, especially in a curriculum of physiotherapist, which I am one, and I'm proud to say that. Generally, we are taught to be a soft tissue specialist. Like, guys, you can ask yourself. I know many people are doing a lot of other things as well, so I'm not generalizing this, but most of them. So what are we doing in a clinic? We are like kind of using passive modalities. Yes, they help. We are doing soft tissue like cupping and all. Yes, they help. We are doing tapings. Yes, they help. We are doing dry needling. We teach that too. They help. We are doing stretching, exercise prescription, everything. They all help. Talk to yourself. They are soft tissue procedures. They are all soft tissue, myofascia. They are all soft tissue. Why is your soft tissue tense? If you're not a good clinician or a doctor, there was a debate recently for being a doctor as well. So if you do not differentially diagnose that why the muscles can be stiff or tense, I mean, you can be a great manual therapist working on the neck and the upper trapezius and the levator. Simple example, differential diagnosis. Patient is having a high BP, high blood pressure. That's why he's having a headache or a tension type headaches.
Yeah.
He goes to a physician, gets a pill for anti-anxiety or a high BP, gone. All the muscle tensions are gone. So differential diagnosis becomes very important. So that is the good part that me and Dr. Cody, along with a lot of speakers at Isomt, would love to help you all in an evidence-based way where we are not just there to pops and all. As I said, it looks fancy. You can use it for marketing, differentiating yourself in this competitive field. But a true doctor and a true patient-centered approach will be while you're doing a proper diagnosis, assessment, and critical thinking. So.
Yeah, absolutely. I mean, I think that's one of the modules with our cohort program as well. There's differential diagnosis, which not a lot of people, actually have an idea or actually would like to learn, but it's so much important. I'm sure that hearing you both out, and not every pain is the same, is probably mechanical, right? So you need to have that knowledge to actually treat, or if it's not under your or not in your hands, knowing when to refer and to whom to refer, right? Like nutritionists and stuff like that, when it's not in your hands. I think everybody, some people just like to take everything in their hands, and it's so much important to know when to refer and to actually differentially diagnose. And that's one of the modules that you guys have, and that's amazing. So
Yeah,
thank you so
and a
much.
simple example, sorry to interrupt, but a simple
Yeah.
example I tell my people is like, say, for example, if somebody's having an angina, a chest pain, and they go to the emergency department in the hospital. I don't know about many other countries, but in India, we know which is the first drug that a resident doctor in an emergency department gives to a patient having a chest pain. If this is live, can somebody tell me that what is the first drug that a resident would like to administer to a patient having a chest pain or an angina-like symptoms?
Yeah, like the first line of treatment.
They
Please,
like to give
in the chat
antacid.
box. Yeah, in the chat box. I mean, although we are from Zoom, we're on live YouTube. So if we could, if you all could just shoot some answers as to what do you all think is the first line of treatment that they do in hospitals when a patient comes to them with angina. In the chat box, please.
I mean, obviously, I'll give you the answer. I mean, you can get the answers there. But yeah, ECG is done. But the first line of treatment a medical doctor would like to give is an antacid and a painkiller. So they might know that sometimes these chest pain can be because of the acidity. So an antacid, a pantoprazole injection, especially in a country like India where we love food, so especially in the night we like to party. So yeah,
Chole bhature.
many. I'm sure Dr. Puri will experience that very soon. So yeah, so those are the differential diagnoses that we teach over here. So yeah, over to you.
Dr. Cody, when you come down to India, I'm sure, hopefully, I'm not sure if you're going to be meeting, but yeah, maybe you should try some of the Indian dishes and hopefully not get acidity post that. Have you tried any Indian food? I mean, can you take spice?
I can. We actually have some really great Indian restaurants here in Sydney. There's also a Sri Lankan restaurant just around the corner. But I am really looking forward to trying all the new and beautiful dishes. I can't wait. Like I want to go on a whole entire food tour as well. So we'll see what I can handle and what I can't.
Don't worry, we'll get your family ready just in case. All right, so let's move forward. I think we're almost running out of time. We've got another 5 minutes. Dr. Parijat, should we take another question, or should we just keep it open for questions to our audience?
Just take the last question, Dr. Rian. Just take the last question with Dr. Cody.
All right, so let's just keep this as a joint question. So what's one assessment mistake that you took, that both of you think that you'll see over and over in clinics, India and abroad, obviously? What do you think, therapists lack? What's the one assessment skill you think they need to work on, basically? And so both of you, I mean, any of you could answer.
I would say, I mean, this is probably from observing other people, in that, and it may not be this way, but I think once practitioners become very comfortable, what they end up doing is just going through the motions without actually critically thinking when we're actually doing the process. And that's really important, because that's when you'll miss something. So if you're just going, yep, do this test, then this one, and it becomes very robotic, that's what becomes dangerous. It is so important that critical thinking is there along when you're doing those examinations, being present, and just really being there to observe properly. You know, I always tell my patients as well, because sometimes they can come in, I was like, oh, that's looking pretty bad today, or this, and they're like, how did you know? And I was like, well, I've got two eyes. A lot of my job is observation, is very straightforward observation, but it's also critically thinking, it's observing, it's really looking at that and then going, I under I have a better understanding of what's going on. And I think that that's where some practitioners, especially ones not necessarily new grads, it's kind of ones that, you know, I've been doing it for a little while. They get a little bit too comfortable and then they start missing things because they're not critically thinking anymore and they're just going through the process. And I think that that's probably the maybe the biggest thing, the biggest problem that I would see. But I don't know. I'm thinking out loud here for you guys.
Absolutely, absolutely. What I would like to answer over there, Dr. Corey, yes, absolutely what you said is correct. But the long game of learning, and if people really are looking for their professional, financial, and personal growth, number one, the mistake that I find is mastering the fundamentals. Everybody wants to be an osteopath today. Everybody wants to be a chiropractor today. Everybody wants to be a specialist today. Yes, great for professional recognition and marketing. But do not forget the fundamentals and the basic anatomy, physiology, biomechanics. Do not forget that. Develop some critical thinking assessment. Focus on a patient centric approach. Invest yourself in mentorship and networks. Like, you surround yourself with experienced clinician, you send us the case studies, seek feedback. All right. And as I said, that prioritize your lifelong learning like we do. All right. So that was my understanding over there. You're mute, I guess. Dr. Rian, you're mute.
Yes, thank you so much for your answers. I mean, I'm sure this has given a great insight to everybody, and that, you know, have attended today, and obviously we'll be posting this on our channel as well. So all of you who've missed it, hey, today's cricket night, right? India-Pakistan match. I'm sure we've lost viewers because of that, but hey, that was something that was unavoidable. We already discussed and decided on the time and the date.
See, workshops, and sometimes what Dr. Rian also mentioned, I'll just like to quickly say this. Yes, people like to invest in like short-term workshops. They are great, with due respect. But workshops, guys, are only a piece of a puzzle. They are not a whole and soul. So true professional and financial growth will come from a disciplined practice, a structured critical thinking, and a good compassionate patient approach. All right. So that's how you like to go when you are looking, and you have to be patient. You can't be just bringing quick results to the patient and marketing yourself. Yes, you will get the results if you focus more on the critical thinking and the why part. All right. So yeah, I can keep going.
All right. I think this was a very insightful live interaction with you both. Thank you so much for your time. Would you like to add in something towards you at the end for our audience? Would you like to shed some light on the program and what they'd, if this is something they're looking at, and to actually get that holistic treatment to their patients? So I'm sure we'll be starting with our batch very soon. So yeah. Would you like to shed some light on that, Dr. Parijat, or?
Dr. Corey, go for it. And yeah, Dr. Corey needs to sleep. It's late in there.
I know. I mean, I'm so sorry. But this
That's
is
all right.
this is going to be the last, and then we'll let you go after. Yeah.
Well, last thoughts.
Okay, let's just We'll let Dr. Parijat take this
Yeah.
question and then we'll get back to you.
No
Yes,
problem.
yes.
But are we taking any questions, Dr. Rian? Let me, before answering that, are we taking any questions from the?
I don't think we have time for that. Let me just go through the chat. But until then, if you could just
Sure.
speak about the cohort batch real quick, and then I'll just get back to you regarding questions.
See,
Yeah.
yes, we are trying, and people can say it rightly. And as I said, we are very honest and ethical. Yes, you can interpret this as a marketing lecture as well, but understand that we in a way is also providing awareness for the people to understand why critical thinking and assessment is important. And the reason being, we have structured, and Dr. Corey and myself and a lot of speakers, we have come up with a structured, disciplined 1-year program where we teach you head to toe, cervical spine, thoracic spine, lumbar spine, pelvis, sacrum, shoulder, hip, knee, and ankle, and not just the manual therapy and the chiropractic part, but the assessment part, the basic foundation part, palpation part, myofascia part, dry needling part, sports injury and sports taping part. So this is a holistic program that you can get. And yes, if your assessment is good, let me quickly share you a quick story. I mean, it was like one day in America, there was a machine which got stopped, and every engineer from all over the world came and hammered, and the machine didn't start working. Well, one of the engineer came and he hammered at a place, and the machine started working. The company asked for a bill. He sent a bill of $40,000. The company said, just for hitting a hammer, you are sending us a $40,000. He said, it is not about hitting the hammer at one place. It is about where to hit the hammer is my skill and my assessment. And that requires that $40,000. And the company had to pay him $40,000, not just to hit the hammer, but where to hit the hammer, you need to learn in your clinical practice. And we can help you with that. And don't worry, we will not forget you. You are welcome to ask questions, concerns after the program, much later, so that we can discuss some case studies as well.
Absolutely. Thank you so much. Yes, I think we shall let Dr. Cody also rest and relax. It's been a long day, and for both of you, actually. Thank you so much for your time. It was a very insightful live interaction. For all of you who've missed it, if your friends have missed it, for whatever reasons, we will be reposting this lecture. Maybe get it edited and cut shots and send shots on YouTube and Instagram. So yeah, thank you so much for your time, and we shall be back with another maybe Instagram live next time. Yeah. So thank you so much and have a good evening.
Sure. Thank you. Thank you so much, Dr. Corey, for doing this. And we hope to see you very soon in our first class starting this September. So 2 weeks later, we'll be commencing this program. And Dr. Corey and myself will be starting on the Align, Assess, and Advance Basic and Advanced Foundations of Maltherapy and Chiropractic. So we will be starting very soon. Yeah.
Amazing. All the best and have a good night.
Thank you. Have a good night, guys.
Thank you, Dr. Corey. Thank you, Dr. Parijat.
Thank you. Good luck.